okay, a few degrees, I'm not gonna be worrying about it, okay? So how would I document that? Who wants to write that on the board for me? Whoever's right there with a pen. She started at 2, 2 degrees of hyperextension, and went to 147. There's no pen? Okay, thank you. Is that a bad pen? So, go ahead. Maybe, okay.
To 100.
47. Okay. So she went to -2 to 0 to 147.
Elbow flexion.
From elbow flexion. Okay? So how would you write that? So active range of motion, very good. Alrighty. Now, if I was gonna show this to a layman, if I wanted to sort of be more specific about it, what else can I sort of stick in there in my documentation? Yeah, for a layman. For us, we could probably figure out which number's flexion and which number's extension. But for a layman person, they may not know, right? Alrighty. So what you want to do is here, backslash, okay, for extension, and then a little arrow, a little dash, and a check mark. Okay? So they know, okay? Remember, if we're communicating among physical therapy personnel, we'll probably could figure out very easily. You give this over to an admin person at a insurance company, they may not be able to figure it out, and then they're gonna call you. Okay? Takes time away. Right? So if she was in a flex, if I wanted to measure extension, what position would I start her out in?
Flexion.
Flexion. So can you bend? Alrighty. My landmarks are the same. Okay. Line her up. Okay. Alrighty. Sorry. Okay. And okay. All right. So right now she is starting at 139. 139.
Okay.
Okay. She's starting at 100. Oh, actually not 139. If this is 180, 170, 160, 150, sorry. I had to count backwards, okay? Can you see why I had to recount? I'm starting over here. This is 0 or what? 180, right?
Mm-hmm.
180. Next one is 170. Then 160, and she's at 150. Okay?
Okay.
Alrighty? Does that make sense?
Mm-hmm.
For everybody? Okay? So line her back up. Okay. Alright, so she's starting at 150 because she's holding it there for us. Alrighty. On the count of 3, can you extend your elbow for me? 1, 2, 3. Alright, keep going, keep going, keep going, keep going. We align everything because everything moved now. Alrighty, she's at 2 degrees of hyperextension. So if I wanted to write this now, what would I write? Who wants to write it on the board? She started at 150.
Elbow flexion, arrow to extension.
Mm-hmm. We're starting at flexion now. Yeah, you could do that. No problem.
100.
Well, 150. It was 150. 2. Very good. All right. Okay. So you get used in the way of documenting this one. When you guys are practicing, all right, write it down real quickly. Okay. You write it out on a piece of paper in your lab manual, anywhere. Okay. On your competency sheets when you're practicing. Okay. Does that make sense?
Yes,
Okay.
But she could probably hyperextend more if not from the table.
Yep. I would have to take that into consideration because if she came off, I'm just gonna have it, stick your arm out a little bit. Now go all the way down. Yeah, she's doing a lot more. Alrighty. Now, if she had a diagnostic condition, then I would take that into consideration. We're looking just at the measurement itself at this point. Okay? Alright, so if okay, scooch back, make yourself comfy. Alrighty, if I was gonna look at testing it passively, okay, seeing how her passive range of motion is this a good position?
Yeah.
Yeah. Alright, she's comfortable. Most people are comfortable when they're laying down in a supine position. Alrighty. Alright, so I would be supporting her, okay, distally. Okay. Alrighty, and I would just try to relax. Alright. Alright. And I would just passively go into flexion. Alrighty. As she's getting in there. What end feel should I feel, by the way?
Soft.
It should be soft.
Oh, yeah, because muscle.
Biceps.
Okay, it's biceps, okay? It should be soft, okay? And I feel that. I feel like it's just falling in when I give her a little overpressure, okay? If I go into extension, supporting it, all right, switch, and I
Hard.
go into a little overpressure there, I'll feel an end feel there, all right? And yeah, I feel bone on bone hitting, okay? All right, so pat for flexion, all right, for extension, okay? Is this the only position, by the way?
I mean, you could also do it
Sitting.
Sitting, yeah, sitting. You would just have to support her more. So let's sit up and I'll show you that also. Alright, because we're gonna go right into manual muscle testing. Okay? Scooch down this way. Okay. Alrighty, so if she's here, alright, I'm gonna support her. I'm gonna be right by her side, okay? You know, just in case she falls off, she's not comfortable, she gets tired, I have control of her. So I'm trying to relax as much as you can, okay? Okay? And I'm just gonna passively bring her into flexion and now into extension, okay? I'm supporting, like near the distal humerus area, and I'm moving the forearm area into flexion, okay? Try to relax, and I'm just gonna passively do a little overpressure to see if I feel a soft end feel, then you should. Alright, go into extension, a little end feel, a little overpressure there, and I should feel a hard end feel. If I'm just gonna do passive range of motion for her as a treatment, spin down, try to relax, get them to relax as much as possible. Alright. Now, depending, if I'm just doing range of motion, on her, it doesn't really matter if I have her forearm in neutral position, supinated position, or prone position, okay? Usually if I'm gonna do it to make sure I get all the muscles into play, I'll just rotate her arm throughout the whole movement, all right? Okay, questions? All righty, now what do I sort of need to watch out for, all right, when I'm doing goniometry? Can't really see it this much on supine, but you could definitely see it here. What may she try to do? Sure, do a little shoulder movement, a little hyperextension, or even, God forbid, a little shoulder flexion, getting you to think she's doing elbow flexion. She'll try to pull something else. So you want to be aware of what they're doing, okay? And you're definitely going to see it in a manual muscle testing, okay? So, again, elbow flexion. You want to make sure you start at the beginning range for against gravity, alright? Because if she's in the middle and she's resting her arm here, yeah, she's probably missing only like maybe 20-ish, 30-ish degrees or so. But again, there can be, you know, a reason. There can be something happening already. So you always want to make sure she's starting in at a 0 position for manual muscle testing, alrighty? So what I'm gonna ask her to do, can you just bend your elbow for me? Keep your back straight as much as you can, alrighty? And bring it back down. Good. Alrighty, and very good. She has full range. Now, if I actually saw a patient only do this, right, what would I do right away? Put her in a gravity eliminated position, alright? Because she only went to 40-ish degrees, alright? So if I see her really struggling to get herself all the way up here, alrighty, she got here, but she really, really struggled to get up here, alrighty, would I put her in a gravity eliminated position?
Yes.
Yeah, alright, just to see if it's the weakness that's contributing to her struggling to get it up there, alrighty, or something else. Alright, so you always want to do, first one, actively, see what they can do first. She did real good, alright, so we're going to go on to the test. Now, looking at it, alrighty, I'm going to add some resistance now, okay? Alrighty, if she was gonna substitute, what would I say she would do? You said she would try to do?
Throw a shoulder.
Throw her shoulder into it, her back into it. So I'm gonna be here at a position of readiness, okay? Now, I'm gonna have using my forearm, okay? Alright, to see what I need to support, okay? Alrighty, so on the count of 3, okay, I need you to bend your elbow up, okay, and I'm gonna resist you a little bit. I'm just gonna have my hand over here to help support you, okay? So on the count of 3, 1, 2, 3, go, 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 and relax, okay? She did good. She really didn't do anything. She did lean a little bit over to your left a little bit, all right? That didn't really happen to nearing the end of the test, all right? So can I do it one more time to show you? Now, if I needed to palpate for her muscles, her biceps contracting, all right, where would I place my hands? You think?
As a tendon?
Yeah, on the biceps, somewhere right here. So I'm gonna adjust my hand position a little bit. So it's here. So on the count of 3, do it one more time. 1, 2, 3. Go, 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 and relax. And I feel her biceps coming into play. Alrighty. Still have my forearm over here to make sure she doesn't do anything. Alrighty. Or feel her do anything. Alright? Alright. If I wanted to test her brachioradialis position, alright, muscle strength, what would I have her do?
Fundamental.
Thumb up. Okay. Can you bring it up for me? Good. And she did it. Alrighty. If I wanted to add resistance, where would it be? Distally. What you want to try to do, okay, try not to be right on the muscle belly itself, okay? Try to stay as distal as possible, because when we're compressing on it, what can we technically be doing?
You can impede her flexion if your fingers are...
Yeah, right, impede her movement. So you want to make sure you try to avoid the muscle belly as much as possible. Right, still at the position of readiness. Alrighty, so on the count of 3, 1, 2, 3, bend. Go, 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 go. Alright, and I can tell. For her, I would probably say 3+. The other one was probably a little bit stronger, her biceps.
It's bigger muscle.
No, yeah, it's bigger muscle. And it's expected. Okay? It's expected. Alrighty. Now, okay, for her brachialis muscle, alright, what would I have her do? A brachialis. I would have a, if this is supinate, in a supinated position is a biceps brachii. This is brachioradialis. What position would I have her in?
Pronated?
In a pronated position. Can you sort of palm up? Okay. What did she just did, by the way, when she went palm up? Do it again. Alrighty? Palm up.
Yeah, she extended her...
Yeah, she extended a little bit, and she abducted a little bit. So can you do me a favor? Try this. All right.
Don't.
Look straight ahead. Try to keep your arm there from moving out. Ooh, your hands are cold. Alrighty? Okay, make sure she's not blocking her own movement. So can you just bring flex your elbow up now? Okay? And up. Alrighty? I'm gonna brachialis. It's covered by what, by the way? Her brachialis. Biceps. So it's gonna hard for me to sort of palpate that muscle. It's good being covered. Alrighty? But on the count of 3, can you do it one more time for me? 1, 2, 3. Go, 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 go. And what did you feel? Did you feel your brachialis, or did you feel more of your biceps, Diana?
Biceps.
Your biceps, okay? Because why? Right? Because of what am I doing when I'm doing this? I'm resisting. Remember, brachialis always comes into play when you're doing high forces or low force activities, right? Your biceps is only going to come into play when you're doing high resistant forces. This, when I was doing this, I was asking her to resist against my forces. So her biceps came into play. So that sort of precluded it a little bit. Her brachialis was still working because your brachialis works with activities that require elbow flexion with high forces and low forces. But your biceps, only for high forces. Okay? Yes or no?
Yes.
Right? So it's sort of a mute test sometimes if you think about it. If you really want to see how strong your brachialis is. Yes or no? Okay? But that's the position you're tested for. Right? So what for elbow flexion gravity eliminated, what would I have to do with her? Sideline. Okay. What if she doesn't want to go in sideline?
Support it.
Abduction.
What,
Okay, support abduction. Because is this, for this, is this against gravity? If she's
No,
doing
no,
it?
no, no.
No, okay? Yeah, I could probably put her in sideline if there's nothing wrong with it, alrighty? But, you know, if sitting is probably a little bit more comfortable position. For me, I would need to be, no, you're okay, alrighty? I would need to support her, you need to look ahead. Okay, sorry. Alrighty, I would be supporting her in an abducted position, try to drop it in my hand. How do you know it's relaxed in my hand?
Heavy.
It gets heavy, and she got heavy, alrighty? So what I want you to do now is bend your elbow. I'll just support it, but you do the motion, okay? I'll guide her along and bring it back, alrighty? If I want to palpate for the movement, alrighty? I'll move my whole hand up a little bit. I'm still supporting her in an abducted position. And using my thumb now, alright? I want you to bend your elbow, okay? On the count of 3. 1, 2, 3. Alright, and I feel her biceps coming into play. Alrighty, what am I doing right now? Can you extend? Gravity eliminated for your triceps. Alright, if I want to palpate, I'm going to adjust a little bit more.
Your bicep?
Yeah. Alrighty, this is for her biceps. Okay. Alright. For her triceps now. Okay. Alrighty. Gravity eliminated position. Have her abduct her arm. Alright. You're supporting it. Alrighty. And have her actively go into gravity eliminated for flexion and gravity eliminated for extension. That makes sense, right?
Mm-hmm.
Okay. Alright. Right? If I wanted to palpate the triceps muscles, alrighty, I would still support her, but I would use my fingers to feel for muscle contraction. Right? If she's that weak, by the way, alrighty, if she's very weak, I would definitely put her in a sideline position so she can be more relaxed. Yes or no? Okay. Alright, what's next? Triceps, right? Against gravity. What position is best for triceps against gravity?
Prone.
What?
I was gonna say that, but
Against gravity. What's? Prone. If she's prone, okay, if she's prone like this. No, not really. Not really. Not really. Alright, not really. Not a great position for me to, then I would have to add resistance. It would be hard for me to add resistance in a way. Alright, what do we tend to do when we're in the gym? People in the gym do.
Just have
Do that way, right?
Yeah.
Yeah. Is that against gravity?
Oh, it is.
Yes or no?
yeah.
Yeah, that's against gravity. So what, is that a great position for me to sort of add resistance now?
No.
Alrighty, because,
It's too high.
alrighty, Alan, you try, since you're already standing on the stool, on him. Is that good? Just, go through the motion.
Not bad.
It's not bad. It's not bad, right? You would have to make sure he's, stabilized a little bit better, right? Right? But it's not bad. You could possibly do it if you need to do it in a pinch. But then you would have to, again, look for where you need to stabilize, alrighty? He's standing on a stool, alright, an 8-inch stool. So what if you don't have an 8-inch stool? Alan's get off the stool for a second. Alrighty? Now try to resist Jin's movement into extension. Alright? Can be, are you more comfortable? Yeah, it's a little bit harder for him to do it. Okay, so yeah, because he doesn't have that right leverage. So if you look at putting her or your patient in a supine position, and again, having her arm at a 90 degrees, that you can do is against gravity position. Okay? Now, yeah, a lot of stuff has to come play. She has to be able to maintain at her shoulder at 90 degrees. Alright? Right? Now that's in a real life situation here. If she can't do this in a supine position, right, most likely that's gonna sort of tell you her tricep strength is not up to par also, okay? Because she has to hold her arm up there. Alrighty, so that's gonna give you that hint. I said, okay, it's probably gonna be a gravity eliminated position that I'm gonna test the triceps in, okay? So, but to show you, can you lay down for me? Here? You want your head on this side? It's not gonna care. Doesn't matter. So, yeah, they're here, so they can see. Alright? Okay. Alright. Can you keep your arm up here? Okay. Alrighty. Now, can you bend your elbow for me? As much as you can. Okay. Alright. Scooch over. Actually, yeah, keep the pillow. You stay, but move the pillow. Okay. It would be this position. Okay. She would have to be able to maintain her arm at 90 degrees of flexion. Alrighty. In a bent elbow position to look at her triceps. Can you straighten out your elbow now for me? Alright. And I'm feeling for the muscles. Okay. Now, looking at her this way, is there any compensation that she may try to do? Thanks. That I may need to worry about?
Like bring her shoulder up?
She might bring her shoulder up a little bit. Alrighty. What I would tell her to do, keep your shoulder on the table. Alrighty. I'm not gonna push her down. Why? By the way, why wouldn't I do this?
Because it will affect the movement.
Yeah, it will affect the movement. I said try as best as you can to put the table. Keep your shoulder on the table. Okay? Try not to roll over. Okay? So, bend your elbow again. Okay? As much as you can. Now go all the way up. Alright? Good. Alright? Anything else you think she may try to do? Yeah.
Flex extend her shoulder.
She might. She might. Right? She might try to extend her shoulder. She might try to flex it even more. Alright? So you want to just keep an eye out for that, okay? So, alrighty, if I'm gonna add resistance, okay, where would it be?
Forearm.
Forearm area, alrighty. If I need to sort of stabilize that area a little bit, where would I sort of keep my hand?
The area of what? Her shoulder?
Her shoulder.
Like right here. Down.
Well, she gonna
It's a
feel
little
comfortable?
awkward. No.
No, is she gonna be comfortable like this? I would be more over here on this side, okay? And if I need to, I could just, again, move my hand slightly to feel for the triceps coming into play. Yes or no? Okay, so can you bend your elbow for me? Okay. Alrighty, so on the count of 3, I want you to straighten out your elbow, alrighty? And I'm gonna give you resistance. Whatever you give me, I'm gonna give right back to you, okay? So on the count of 3, 1, 2, 3, go, 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 go. Alrighty, and I would have her hold this resistance for approximately 3 to 5 seconds. Alrighty? Because what happens here? Right? Is she still 100% against gravity with her triceps? No. Alrighty? So at that point, as she goes past that 90-degree mark here, it's not truly against gravity anymore. Alrighty? So I'm going to ease up on the resistance a little bit. Alright? Or I may even stop the test altogether. Okay? Alright? One more time. Okay, right here, on the count of 3, 1, 2, 3, go, 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 and relax. Good? Alrighty. You still good to go? Just a couple more things, okay? Alright, so forearm supination, pronation. Can you sit up for me?
Professor,
Mm-hmm.
quick question. Like, would it be possible to do something like that on the table? Like, let's say, like the elbows on the table over here, and then you like stop them as they're trying to do that.
But she's already in a gravity eliminated position when you're doing this. So, do people do it in the clinic? Yeah. Alright? But you're gonna have to adjust your grading a little bit. Alright? That's the thing. Alrighty? And be aware. If this is your patient, this is what you could do in the clinic. If it's your patient that you're constantly gonna be always be treating, okay, because you know exactly what you need to document. If somebody else, because you're out that day, and they have to, assess the strength, and they may have a slightly different way of testing, they may get some weird results. So they're gonna say, oh, this doesn't make sense. And then what if he just sends it off anyway? Right? And then that's that conversation you're gonna need to have. Okay? Alrighty, so forearm supination, pronation here. Alrighty? Yeah, what plane? What plane is this happening in? Transverse, horizontal, okay, longitudinal axis. Okay, so when looking at it like this, where am I gonna put my goniometer? If she's just doing this. Where am I gonna put my goniometer? Yeah. It's kinda hard, right? Yeah. Right? So when you're looking at measuring supination, pronation here, what position should her at least the forearm part of the motion be in? Should she be in more supinated position or more pronated position?
Maybe neutral?
Position?
Neutral.
Neutral. Because then you can sort of test. She's starting at a 0, because you're calling her neutral, okay, like this, thumbs up position. Alrighty. She goes into supination. Right? Goes back into neutral, goes into pronation. Okay?
So your 0 will be neutral?
This would be my 0. Okay? Now, to sort of help things out a little bit, can't really use your thumb and line up the goniometer because, some people's thumbs are small. Okay? What you want to do, if they make a fist, right? Hold a pen, right? Keep your thumb on the pen like this. This is an extension of your thumb to keep everything in line. Because what's this also sort of lining up with?
Humerus.
To sort of keeping up for your stationary.
Humerus.
Your humerus, all right, for your humerus. So sort of makes it a little bit easier to use, okay? All right, so, right, are you comfortable like that, or do you want something to rest on? You sure? Okay. Now, if she wanted the stool, all right, you can set her up with the stool like this, all right? Put it like this. Right? Be aware it doesn't always work, more for the fact, okay, depending on the length of the humerus, okay, because she looks like she's leaning down already. And what else, okay, can come into play? She is in abducted position, all right? So what I tend to do, which is a little bit better, keep your arm like that, bend your elbow at 90. Can you use your your left arm to hold like this? Okay, so like this. Keep it like this. Hold. Keep it there. Am I going to really, if she rotates a little bit, is that going to affect me a lot?
No,
For the motion? Because I'm doing this, okay, so I'm not going to, if she has to rotate a little bit, her trunk, okay. I mean, if she rotates a lot, that's a different story. Okay, so what I'm going to have, okay, can you hold my pen for me? Okay, alrighty. Now, her axis of motion is the in-between point of your forearm, between the radius and the ulna, right? So what I'm going to do, I am going to pick an arbitrary point on her middle finger, okay? Alrighty? Sometimes it sort of works out to be in her proximal PIP, alrighty? Again, it depends on people sometimes. It doesn't always 100% work out when her thumb is lining up with the PIP or not. She's slightly a little bit more proximal to her MCP. So I'm going to pick a point there. You guys just sort of need to sort of remember that, okay, what point you picked. Okay, are you comfortable? Alrighty. This I'm going to transfer to a smaller goniometer. Alrighty. Okay, keeping it like that. Try not to rotate as much as you can. Alrighty. Now, to make life simple here, alrighty, her stationary arm, okay, is going to be perpendicular to the floor of the table, right? Because if I do this, I just have to keep an eye on more things, alrighty? If it's like this, life is simple, right? I don't have to worry about a lot of stuff, alright? So I'm going to line her up, okay? Right? Line up my moving arm, okay, with my pen, okay, and my proximal arm to the perpendicular to the floor, and my fulcrum is my point that I'm going to remember that for the fulcrum, okay? All right, so before I measure, can I just see you go palm up? Okay, she's doing palm down first. All right, all right, so again, I see what's going on, okay? So she has relatively good range of motion. I remember that number. So can you keep my pen up there, straight up, all right? Line everything up again, okay, all righty. Now, on the count of 3, can you turn your palm up for me? 1, 2, 3, all right? Readjust everything, line everything up, okay? Line it up with the pen. Alrighty, so she started at 0 and she went to 80 degrees. So what would this be? Is this normal? Yeah, she's a little bit less. She's a little bit less, because normal is 90 degrees. Okay? Alrighty. So this would be 0 to 80 for supination. Alrighty. So hold it up like this. Pick my arbitrary point again on my middle finger. Alrighty. On the count of 3, can you turn your palm down? 1, 2, 3. Go, 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 go. Alright. She's actually pretty good. Alright. Bring it away. She has 95 degrees of pronation. Okay. So shake your hand out for a second. Okay. Relax. Relax your hand a little bit. Okay. Are you getting tired?
No.
You sure? Okay. All right, let's try it one more time, because that is a little bit more. All right, because most people only have 75 degrees of pronation. So I'm gonna measure her one more time. Okay, line her up. Okay, and she is at 0 degrees. Okay, so on the count of 3, 1, 2, 3, turn your palm down. All right. Oh, don't do that. don't do that with your show. That's why. Okay, don't do that. Right?
What was
Just
she
go.
doing?
She's starting to internally rotate.
Oh, her shoulder?
Yeah.
She's gonna go like that.
Yeah, she's starting to internally. Try to keep your arm. Keep it like that.
Yeah, I
Okay.
didn't notice either.
Alrighty.
I'm retarded.
Okay. Okay, let's try it one more time. Line her up. Okay, 1, 2, 3, go. Okay. Alrighty. Yeah, she still has a little bit more than 90 degrees, okay? Alright, so sort of be aware of it, okay? Again, it can be the way the fact where she's holding her pen, alright, because, alright, so you need to be aware of it, alright? Alright, so using the pen as your landmark, yes or no?
Yes, ma'am.
Okay, so that is forearm supination and pronation, okay? And if I was gonna, for passive range of motion, relax a little bit, okay, alrighty. I'm gonna wanna support her. Is this my only position that I can do this in? Where else would be a nice comfortable position for her?
From the back.
On the back, on her back, alrighty, alrighty. I could possibly do it standing, but again, I want her as comfortable. So I'm gonna try to relax, okay? I'm gonna pronate her, alrighty, a little end range, a little overpressure, alrighty, supinate, a little end range, okay? And I should feel from end feel
Oh, yeah.
on both sup and pro. Alrighty. Now, sort of looking at manual muscle testing, what position would I have her in? For manual muscle testing. Thinking about the horizontal plane now, because it isn't in the horizontal plane.
Yeah.
When you do supination pronation.
Yeah.
Yeah. Alrighty. So yeah, it is. Is there any way for me to get that into against gravity position when you see supinating or pronating?
Wouldn't she have to change midway? Wouldn't she have to change positions? She'd have to like
Yeah.
flip over.
Yeah. Alrighty. It is not an ideal situation. Alrighty. Because again, this motion occurs within the plane, within the horizontal plane. So it is kind of hard to find a position that's gonna be 100% against gravity. So yes, there is subjectivity to this test. Alrighty? There is subjectivity. Right? Best thing that we can do is to be in a sitting position with her arm like this to make sure she doesn't do any internal or external rotation. Alrighty? Instruct her well. Okay? Alrighty? And explain to her what you're gonna be doing. So, alright, Diane, what we're gonna be doing. Again, you're gonna keep your arm here. You want me to do it on that arm? Or no, you're okay? Okay? Alrighty? You're gonna keep your arm against your trunk. Alrighty? And you're gonna use your other arm to support it. Okay? Now, when you're ready, I'm gonna ask you to supinate. Alrighty? And I'm gonna prevent you from completing this motion. So I'm gonna add a little resistance. Alrighty? Now, when I'm doing that, okay, I want you to resist me as best as you can. A lot of people tend to do this kind of thing, alrighty, when you're doing it. What happens when you do this kind of thing?
You're resisting her when she's.
Yes, resisting the supination, okay, alrighty. But what else am I gonna tend to do?
Hurt her?
Squeeze. I'm gonna squeeze her really hard. Yes, in the clinic I see people do it all the time. People are not too comfortable with that. Okay, they just don't like being squeezed. Because what am I gonna end up giving her?
A burn.
A nice burn here. I'm gonna give her a nice burn if you do this multiple times. Alrighty? So what I try to do, okay, to sort of prevent that, I'm gonna sort of use the heel of my hand. Okay?
Heel.
This is the heel of my hand, okay? I'm doing it, okay? So I'm gonna, this way. I'm gonna be this way. Alrighty? I'm gonna be supporting her, alrighty? From on below, alright? And I'm gonna prevent giving her added resistance, okay? So on the count of 3, you're gonna supinate, and I'm gonna sort of try to stop you, okay? Alrighty? 1, 2, 3, go, 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 go. Do you feel that resistance? Okay? Alrighty? It's not the easiest test to do, because what am I doing again? Resisting against what? Alright? For supination in the plane of the horizon, alrighty? So it is not an easy test to do, alrighty? Now some people, like I said, I've seen people do this, alrighty? So on the count of 3, I want you to supinate and I'm gonna resist you, okay? On the count of 3, 1, 2, 3, go, 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 alright? No, you don't like that. She doesn't like that, alright? She told me don't do that, alright? Because what was I doing? What was I doing? Yeah, I was really squeezing her. Alright, so what you want to do, using the heel of hand, supporting her, and prevent that motion from happening. Okay? Alrighty? Now, you do have to sort of break this up into different components, okay? If you want to feel for the muscle palpation, what 2 muscles? The 2 big guys are?
Supinator.
Supinator and?
Biceps.
And your biceps, okay? So, go neutral. Alrighty? Can you supinate for me? Alright? Slow force, not really feeling much, right? Alright, can you try one more time? I'm gonna put my hands a little bit deeper. Alright, and right now, I'm more on the lateral aspect. Oh, sorry. The medial aspect, okay? Just below her elbow joint. Alright, can you, alright, supinate for me? Alright, and I feel her muscles coming into play. Alright, I feel it just with my 2 fingers. Okay? Alright, so that is for supination. Alright, for pronation, where would I resist, you think? This side. Okay? So again, I'm gonna use my heel of hand because Diana already told me don't do that. Alright? Doing that sort of like that handshake movement. Okay? So I'm gonna place, nope, this way. Alright, for me, alright, her pronator muscle, stabilize her a little bit. Alrighty, so on the count of 3, actually, can I see you just pronate first? Good motion. Alrighty, now I'm gonna resist you a little bit on the count of 3. 1, 2, 3, go, 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 go. Alright, for the movement, alright? And I'm just preventing that motion from occurring, okay? Alright, one more time, yes or no?
Yes.
Okay, alrighty. On the count of 3, 1, 2, 3. Oh, wait for me. All right. 1, 2, 3. Go, 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 go. And I'm just slowing down that movement, resisting it a little bit. Okay. Hey, what can I do for gravity eliminator? By the way, take a guess. No, you're close. You're close. What did he just do? He went.
Flexion.
He went into more shoulder flexion. Is it great? It's eliminated more. Not eliminated, it's minimized more. Is it totally 100% eliminated? No, but it's minimized. So I'm gonna flex her to, less than 9, like 45-ish degrees a little bit. Alrighty, and I'm supporting her. Alright, neutral position again. Can you turn your palm up? Alright, turn your palm down. Alrighty, and you're gonna be palpating. Alrighty. So if supination, you're going to be palpating for the muscles, okay, on the medial aspect right by her biceps, okay? So if she's in neutral, right, can you turn your palm up? Alrighty, palpating for her muscles there. Alrighty, can you bring it back? Alrighty, if I'm gonna be palpating for her pronators, I'm gonna be on the lateral aspect. Can you turn your palm down? Very good. Okay? Right? So that is just sort of getting it in a slightly eliminated fashion. Questions? Alright, so you're gonna spend, okay, the next 2 hours practicing the elbow. Did we do everything? Did I do everything? I think I did everything, right? Right? You're gonna spend the next 2 hours practicing this, okay? If you wanna take a little quick break, go eat something, by all means, go eat. Alright? But I'll be in the room for you guys if some of you guys wanna stay. Alright? Off you go.